Nurses have the awesome experience of entering the lives of patients during often traumatic and difficult times. Patients come and go. Some get better, some do not. We take care of them during these traumatic times and often never hear from them again. I look back, and as a new nurse, I enjoy taking care of the patients who were alert and oriented and walkie-talkies, as we call them. They could walk and talk. But of course, the day came when that assignment came. I was assigned a patient with a closed head injury due to an automobile accident. This patient could open his eyes, but could follow no commands, could not focus on anything. The patient could not talk, only moan and groan. This patient could not walk, only thrash about in the bed. This patient was unable to follow any commands. This patient was not an adult. This patient was 16, a teenager. This patient wouldn't even know that I was in his room. What good could I do for him? He was a total care patient. So with fear and foreboding, I nervously entered his room, felt so unprepared for this assignment. His father was standing by the bedside. The patient was restless and agitated. I began my nursing assessment, took care of all his physical needs, and then there was awkward silence. So I turned to his father and asked him about his son, and he shared with me the things his son enjoyed in life, how his son's smile and laughter would light up a room. This informal patient conference changed my attitude toward this patient. As the night shift progressed, that young teenager became more agitated, thrashing about in the bed, moaning and groaning. I didn't know what to do for him. There were no new innovative or technological advances that I could call upon that night. His father was getting upset and distressed because his son was so upset and distressed. And I paused. That light bulb popped above my head, and this phrase came to my mind: music soothes the savage beast. It couldn't hurt to try. So I went to the bed and I held my young patient and I started rocking him gently, and I started to sing a lullaby. Sleep, my child, and peace attend thee all through the night. Guardian angels, God will send thee all through the night. It was working. I sang another one. Hush-a-bye, don't you cry. Go to sleep, my little baby. When you wake, you will find all the pretty little ponies. Those muscles that were tense were now relaxed. Respirations were even and non-labored. Eyes were closed. I gently laid this patient down, and he was able to sleep. This became our nightly ritual. His father and I both amazed that it could work. The soft hum of a lullaby worked its soothing magic. Mission was accomplished. Eventually, our young patient became better and was transferred to a rehab center specializing in the care of those with closed head injuries. I often wondered what magic they could do in the rehab centers to help these patients who were so severely compromised. Time passed. Several years passed. I was still working on the same patient care unit. One evening I was standing by the nurse's desk and talking to the unit secretary, and a young gentleman came up the hall. He stopped. I asked him, could I help him? He said, you used to sing to me at night and rock me to sleep. He said, I remember your voice. I was shocked and stunned. He did know I was in the room. I did make a difference. Never again would a diagnosis cloud my judgment of a patient. I would never underestimate what they could hear or what they could do. This moment has forever been etched in my heart. It made me a better nurse and ultimately a better person.